Hi guys, now we heard a wonderful case discussion about lower GI bleeding. Now, lower GI bleeding is any complaint where a patient presents with history of bleed per rectum. Most of the time, we will consider a lower GI source if there is frank blood in stools. Okay, this is what we have to remember the basic concepts. Now, over the next half an hour, we will be just discussing about what are the common causes and the basic presentations, and then we'll be seeing into how to evaluate and manage a patient with lower GI bleeding. And we may also concentrate on few of the common questions that they might ask in Viva OC. Okay, so the first thing that I would want to discuss at this point of time is what is the most common presentation of lower GI bleeding. Now, when it comes to lower GI bleeding, usually it will be an elderly gentleman who presents with a painless hematochezia and a decrease in hematocrit. Okay, this is a common presentation. Usually there is no history of orthostasis. Okay, what we have to know is when there is postural hypotension, you should actually think of an upper GI source, a frank upper GI source presenting as a lower GI bleed. This is some important fact that you should know. So most of the time it will be an elderly gentleman, say around 70 years, presenting with painless hematochezia. On examination, there will be hemoconcentration. There may be drop in HB. Okay, so there's a decrease in hematocrit. Usually you will not find orthostasis or what you call as postural hypotension. If at all you have this, you should start considering probably it is an upper GI source. Okay, these are the basic points I would want to just see about what is the most common presentation. Now we know what's the most common presentation. Let's know what is the most common cause for a lower GI bleed. The most common cause for LGI bleed. This is a common question in your exams. The most common cause for a lower GI bleed is diverticulosis. Okay, remember diverticulosis, painless hematochezia. Usually it is seen in approximately 30% of cases. Okay, very important number. The other causes could vary from colonic polyps, it could be malignancy, it could be colitis, it could be anorectal disorders, each contributing approximately to around 20%. Okay, so the most common cause, they might confuse with hemorrhoids and the student get confused. The most common cause is diverticulosis. Okay guys, so it's usually seen in elderly around 60s and 70s and much higher. Next important thing is when a patient presents to us, they'll ask you how are you going to manage this case. First thing you should always see is based on the history, if patient is unstable, you are going to resuscitate.